Good evening, everybody, and welcome to the webinar from the National Collaborating Center for Methods and Tools on evidence-informed decision-making, methods and tools for students in public health programs. My name is Emily Clark. I'm a knowledge broker with the NCCMT. Thank you so much to everybody who has joined us this evening. And I will hand it over to Dr. Susan Snelling, who is a Senior Knowledge Translation Specialist with the National Collaborating Center for Methods and Tools.
Well, thank you, Emily, and hello, everyone. It's Susan Snelling here. Thanks for joining us. I'm really looking forward to this evening's session. We'll just have a couple of details to talk about just in terms of how we're going to manage the webinar. We welcome your thoughts and comments and input at any time, and you can use the chat function for that. Probably best sending to all participants because then people can see your questions and the answers as well. I'm seeing some discussion already there in chat just in terms of how to connect. So hopefully people are hearing my voice now and able to see the slides. We will have a specific question and answer discussion session at the end of the webinar, but certainly please feel free to post anything in chat as we go along. We're happy to hear your comments and questions as we talk through some of this. I'd also like to welcome you to use chat right now, especially if you are joining in with a group. So I know of a couple of settings where people were going to get together to listen to this webinar. So it's great for us to know if there's a bunch of you out there. So if you want to just use chat to send a shout out from wherever you are, just let us know you're out there. Now, if you would like to review this webinar, see the slides, the PowerPoint, NCCMT.ca, previous webinars. We'll get that to you. The recording will be up in about a week, so that will be available for you through our website. So our agenda for this evening, I will give a brief introduction to the National Collaborating Center for Methods and Tools, NCCMT, and the National Collaborating Centers. There are 6 of them, and I'll describe where those are and what they focus on in a moment. Then I'll talk just a little bit about what we mean by evidence-informed decision-making. And we're really fortunate tonight to have student perspectives or recent grad perspectives on resources that they feel would help them to support their evidence-informed practice, either things that would have helped them when they were in school doing their studies, or things that are helping them now as they're engaging in evidence-informed decision-making in their work context. So you will hear mostly from 3 students or recent grad presenters who will talk about some of those things that they've learned and some of the things that they have found useful. And then, as I said, we will have question and answer and discussion section at the end, and certainly welcome your input in terms of perhaps other resources that you like to use when you're trying to engage in evidence-informed practice, questions you have about resources that you may be looking for and haven't quite found the right thing for, or any questions about some of the resources that we talk about tonight. So with that, we have some learning objectives for tonight. So hoping that you will be familiar with the key features of a model for evidence-informed decision-making. I call it EIDM, but if you hear me say that, it's evidence-informed decision-making. And we'll also talk about a process for evidence-informed public health. You will certainly know where to access tools and resources that will support students and others in public health to find and to use the best available research evidence in decision making. And I'll give you a hint on that objective right now. NCCMT.ca is the source for a lot of the resources that we will be talking about tonight. And finally, to listen to the perspectives of public health graduate students on the value of evidence-informed practice, the tools that they have found helpful, tools maybe that they wish they had known about when they were earlier in their studies or in their careers. So just to get a sense of who is out there, we'd like to hear from you in terms of your role. So are you an undergraduate student, a graduate student? Are you program faculty, or perhaps none of the above? You're all welcome, but you can vote now, and we'll just give that a moment to come in. So Claire, can we see the result of that one?
So they should be popping up now, but just to give, I guess, maybe a little bit of a breakdown, most of the participants tonight that are joining us as graduate students and a couple undergraduate students as well, and some that are in other categories that we'd love to know about.
Fantastic. Okay, thank you. That's great. Good. Well, welcome everybody. So I'll give just a little discussion of the National Collaborating Centers. So as you can see on the map, there are 6 National Collaborating Centers. They are, of course, national, hence the name. So they, all of them serve across the country, but they are located in different places. So the National Collaborating Center for Aboriginal Health is in Prince George, BC. The NCC for Environmental Health is in Vancouver. The National Collaborating Center for Infectious Diseases in Winnipeg. The National Collaborating Center for Methods and Tools, which is our center, in Hamilton, Ontario, at McMaster. The NCC for Healthy Public Policy is in Montreal, and the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. The National Collaborating Centers were developed as a way of moving evidence into practice in a variety of domains, and you can see the topics there. The National Collaborating Center for Methods and Tools focuses on, well, you guessed it, methods and tools that allow people working in public health to find and use the best available evidence. So whereas other national collaborating centers are focused on evidence in particular areas, particular topics, particular spheres of work, the National Collaborating Center for Methods and Tools almost takes a step back from that and actually focuses on those skill sets, resources, tools that will help people to find and understand and use evidence. And the reason really that gave rise to the development of the National Collaborating Centers as a whole was in response to SARS. So there was a recognition after that that perhaps there was not sufficient access to evidence, skill sets related to evidence to really create a good, solid, robust public health program and system across the country. So the National Collaborating Centers were developed really with that purpose of supporting people who work in public health to find and use evidence. The centers support partnership and collaboration between researchers, policymakers, and public health practitioners as a way of translating knowledge. So some of that knowledge that comes from research or from the policy sphere can be used in application in public health. And the other way too, things that we learn in our public health practice can influence what researchers choose to look at, how they understand phenomena, what happens in the policy world. So very much that connection between both generators of knowledge and evidence and users as well. So when I talk about evidence-informed public health, here's kind of the fancy definition and then the very plain language definition. We describe a process of distilling and disseminating the best available evidence from research, context, and experience, and using that evidence to inform and improve public health practice and policy. In other words, finding, using, and sharing what works in public health. And I would emphasize here that we are really serious about saying it's the best available evidence. You may be working or doing research in areas where there is not yet a lot of evidence. Sometimes there's a really emerging issue that we don't know very much about from a research point of view. And so if that's the case, then the best available is what's based on that really limited collection of research. So the knowledge that we have is always changing and growing. What we focus on in evidence-informed public health and evidence-informed decision-making is using the strongest, the best available evidence. And in order to determine what is the best available evidence, you have to be able to find it and then assess the quality of it so that you know what is the best. So that's a little bit of a preamble to the kind of methods and tools that we will be hearing from or about tonight, is tools that will help people to find, use, and share those best available pieces of evidence. Now, this is a model that we use a lot at the National Collaborating Center for Methods and Tools to describe the process of evidence-informed decision-making in public health. And I would say that it probably applies in many other fields as well, although our particular area of focus is the public health and population health world. So just to unpack this model a little bit, what we focus on at NCCMT is largely in the bottom left circle, the research circle. So helping people to find that research evidence to bring to their decision making about what programs to offer in public health, what interventions are likely to be successful, and so on. But we recognize that there are many other factors that influence decision-making in public health. It's not only about what the research says, it's also about what are the pressing issues in the community, what's the local context. It's about community preferences, political situation, what people will accept or tolerate, which we know might be different in one community than another, public health resources, and that's both skill sets as well as financial resources. So the research may say that a certain program is really effective and has good outcomes, but if you don't have the skilled people to deliver that program, or if you can't afford it, then you're not going to make a decision to implement that intervention. So all of those things come together along with public health expertise, knowledge that people have in the field about what will work, what happens when we try new things, if we have to implement something new and give up something else. There are factors that come into that decision as well. So decision-making is complicated. There's really no question about that, and certainly in public health where we are very much in the public eye when we're making decisions about what to do, programs to offer, and so on. So this model is helpful because it positions all of those influences and shows that research is an important piece, should be really a fundamental piece in our decision-making process, but also recognizing that research will not be the only thing that brings to bear on our decisions. Now, over the past few years, I've been doing a series of webinars targeted to different audiences. So public health inspectors, for example, people who work in healthy weights areas, people who work in mental health. Tonight's webinar is focused on students, and that's not to say that the methods and tools that we're going to be talking about are really designed specifically for students, but there are some resources that we think are probably really good for students to know about, both in terms of the kinds of things that they need to do in their studies, as well as kinds of things that they may want to build skills for when they're in the working world, or what they're bringing back to their work in public health. So in order to actually get to some of those methods and tools that are really most useful to students, we asked recent MPH grads a couple of questions. So the first question I posed to our three presenters is, how are evidence-informed decision-making skills important in your studies and or in your work in the public health field? And so you'll hear what they have to say about that in just a second. And then the other question I asked them was, what's an evidence-informed decision-making resource that you have found useful? Or maybe it's something that you wish you had known about that you know about now. So it gives me great pleasure to introduce our presenters. And as you're thinking about this work too, for those of you attending the webinar, you might ask yourself this question too. How do you see evidence-informed decision-making skills being important in your studies and in the work that you do? Are there resources that you have found useful to support evidence-informed decision-making? But let's now get to our presenters. So we have three, and I'm going to ask them to introduce themselves and just tell us a little bit about when and where you got your degree and the type of work that you are doing now. So first of all, Shelley Russell.
Great. Hi, everybody. It's nice to be with you here tonight. So I'm Shelley Russell, and I'm happy to say that I've just completed the Master of Public Health program at the University of Waterloo. I was a part-time student there with their online program for the past 4 years. I did the program, and I also worked at the same time, so the part-time program worked out well for me. And I'm looking forward to attending our graduation ceremony that's coming up on October 20th. So yeah, so definitely recent graduate. I've also enjoyed being a public health nurse in Ontario for about 15 years now, and I've focused mainly in the area of chronic disease and injury prevention. So like I said, it's great to be here with you tonight, and I'm glad everybody was able to join us.
Great. Thank you, Shelley. Next, we have Kristen Reed. So Kristen, can you introduce yourself, please?
Absolutely. Hi. So I completed my MPH specializing in health promotion at the University of Alberta in 2014. And currently I'm working as a research coordinator for Health Evidence, where I help to manage a comprehensive registry of quality-rated systematic reviews on the effectiveness of public health and health promotion interventions. And I'm also involved in the coordinating of the National Collaborating Center for Methods and Tools dissemination strategy. So things like our newsletters and social media platforms, as well as engaging with other external organizations to help promote our products and resources.
Great. Thank you, Kristen. And our next presenter, Claire Howarth. Claire, can you introduce yourself, please?
Yes, hi everybody. My name is Claire Howarth, and I'm a research assistant at the National Collaborating Center for Methods and Tools. I completed my Master of Public Health in 2015 from Memorial University of Newfoundland. As a research assistant, I work on almost all of the activities at the NCCMT, but more specifically, I help with supporting webinars like the one tonight, attending conferences, conducting critical appraisals of literature, and also conducting quality assessments of our Registry of Methods and Tools and our online learning modules.
Fantastic. Thanks, Claire. So you'll see that at NCCMT we're fortunate to have recent grads working with us and having done internships with us. So looking forward to drawing on their experience in tonight's discussion. So the first question that I asked to Shelley and Kristen and Claire is, why is evidence-informed decision-making important? How are those skills important in the work that you do in the public health field? So I'll maybe ask Shelley just to comment on that first about why it's even important for us to be thinking about evidence-informed decision-making and build those skills. Shelley?
Sure, that's great. So when I was thinking about this question, I came up with kind of 5 main themes that related to this. And so the first one is my relationships with stakeholders that I work with. So I'm certainly able to better explain to internal and external stakeholders why we're focusing on a specific interventions and what the outcomes of the interventions are by following the evidence-informed decision-making process and using the model as well. The second key point was understanding of public health issues that I'm focusing on. So I certainly feel like I have a better understanding of the public health issue I'm addressing after going through each of the steps of the EIDM process. My core competency skills, so certainly evidence-informed decision-making has helped to expand my public health core competency skills, such as assessment and analysis, applying public health sciences, using evidence and research, and also for policy and program planning, implementation, and evaluation. And these expanding on my core competencies were key priorities, was a key priority for me, both in school, but also as in my work as a public health nurse. It's also increased my capacity to contribute to projects in school and at work. I've been able to share the knowledge about evidence-informed decision-making with others, which also expands on my leadership and communication core competencies. And the fifth one is the awareness of supporting resources that are available. So it certainly has increased my awareness of knowledge repositories that I can access easily, such as Health Evidence or the Optimal Aging Portal. And it's very helpful that some of the systematic reviews that are there are pre-appraised for quality as well. So that's been quite helpful to me moving forward. And I've learned a lot about evidence-informed decision-making through all of these key points.
Great. Thank you, Shelley. That's super. Thanks for those thoughts. Kristen, from your perspective, why are evidence-informed decision-making skills important in the work that you do?
Thanks, Susan. So I think for me, I sometimes think of the process of evidence-informed decision-making as something of a continuum between research and practice. And so to use kind of this process and evidence in decision-making, you kind of have to have the skills on both sides of that spectrum, which includes on one end understanding research findings and what results of studies actually mean, and then on the other end how those findings can fit into existing practice while taking into consideration those other areas of public health expertise that were mentioned earlier, so in the model for EIDM, so things like local context or existing resources. In terms of the work that I'm doing at Health Evidence, having the knowledge and the skills to search academic databases, use reference managing software, and to be able to quickly assess the quality of a study or a systematic review are really central to my day-to-day activities in managing the Health Evidence Registry. And I think that these are the same skills that I really started to learn and hone in on during my undergrad, and especially going into my master's for writing papers and completing some of the assignments in terms of defining a research question or efficiently searching through both the academic and the gray literature, assessing the quality of the research that was identified, and then kind of even just bringing it all together and synthesizing what was found. So I guess essentially overall, the importance of knowledge translation and evidence-informed decision-making, and what I think of as the goal of the evidence-informed decision-making process is to make sure that what we do in public health is the right thing to do to the best of our knowledge, and really continually working to build on these skills and learning more about the EIDM process as a whole kind of helps us to become more confident that a specific program or policy that is being implemented will work to improve the outcomes of interest and really promote health more generally.
Great, thank you. And Claire, from your perspective, why is evidence-informed decision-making important?
Thanks, Susan. So Kristen and Shelley just gave really great answers. Yeah. So I thought about this more from a personal perspective about the work that I do on a day-to-day basis. So evidence-informed decision-making skills are really important for me because I'm conducting critical appraisals of literature on a day-to-day basis, which is an important part of evidence-informed decision-making, as well as searching and synthesizing literature, which again is an important part of evidence-informed decision-making. And also it's important for me to have these skills so I can clearly communicate about evidence-informed decision-making and evidence-informed public health overall, specifically in my role as responding to emails and questions at conferences from public health professionals who use our resources.
Great. Thank you so much. So yeah, this is really, it's great context, and I think, you know, for people who are thinking about where they're going to work in future, the kinds of skills that employers are looking for, certainly in my work in the public health field, and I've worked in local public health, I've worked at the provincial level as well as national level. Employers are always saying that they are really excited when new staff come to them with this kind of skill to be able to really dig into research evidence and literature. And just from the examples of the three people who spoke, there is that sense of those skills get used in a wide variety of different places, local public health as well as in other contexts. So thanks for sharing those thoughts about the work that you do and how evidence-informed decision-making connects. And as I said, if others on the line want to contribute as well in terms of how you've seen those skills be important in the work that you do or in your studies, by all means, drop us a note in the chat box. So the second question that I had for our resource people tonight is, what evidence-informed decision-making resources could be useful, particularly for students? And you know, some of these I think were resources that they were aware of when completing their studies, and in other cases they're resources that they've kind of found out about later and thought, hey, you know, really wish that I had known about this. So we'll have a little bit of a mix through that, through the discussion that's coming. So we're going to kind of alternate, because I asked these questions ahead of time, asked them to tell me what resources really came to mind. So the first resource that we'll talk about is the what we call the wheel, so stages in the process of evidence-informed public health. This is a really key process that we talk about at the National Collaborating Center for Methods and Tools. It's a 7-step process that describes the steps in the process of evidence-informed public health, we tend to start at the top of the wheel with define. So there are some methods and tools that will help people to really define a good question, so that when they're going to look for evidence, they're finding things that are relevant and finding the best quality pieces of evidence. How to do a good search, how to appraise the quality of that evidence so that you really are getting to the best available. Synthesizing evidence, so bringing it together, because of course when you go to multiple sources, multiple studies, multiple systematic reviews, sometimes they come to different conclusions, and we need to have skills to actually bring those together in such a way that can really help us inform our decisions. Adapting evidence to the local context is a really important piece of the applied kind of work that we do in public health. Actually implementing a decision, so once you've decided to do a program or make a change to a program, it's not just like you snap your fingers and that happens. There's a whole process involved in implementation, and then evaluation. Having some ways of knowing whether you've used evidence effectively, whether the change that you hope to see has actually taken place. And all of this is shown in a circle because as we evaluate, we come up with more questions. And so the circle begins again, we define new questions, and the evidence, of course, is always changing as well. So what we understood to be the best available evidence at one time may change as we go forward. And so we tend to see that the cycle is repeated from time to time as we try to understand evidence in the context of our work in public health. So, Shelley, you said that the wheel was something that you thought was really helpful. So I'll just ask you to talk about why that is and what you see that's useful about the wheel.
Sure, that's great. Thank you. When you asked me that question, Susan, I was sitting at my desk at the time, and the first thing that I saw was the wheel actually sitting in front of me on my bulletin board, and that's where I do keep that wheel to remind me of both the process and the model. So I'm very thankful to have the wheel that I can refer to and have the reminder there. It's a nice visual tool to have with me when I was talking to classmates or to even colleagues at work about evidence-informed decision-making. And it is one of the resources that I received in my first couple of weeks of the MPH program at Waterloo, and it does continue to be helpful in my work as a public health nurse as well, and I know a number of my colleagues in the workplace find it helpful. So that was one of the first tools that came to my mind for sure. The evidence-informed decision-making 7-step process that you just described there, Susan, and also the model that's on the back that you described earlier has provided me with a greater understanding of each of the steps that should be taken when addressing a public health issue. And then additional tools and resources on the NCCMT website allowed me to access a variety of resources to enhance my understanding of each step. So there is more detail on the website then that we can refer to, which was also helpful. It was helpful in many of my courses when we were asked to address a specific public health issue, so looking at a specific issue and then working our way through in terms of what our recommendations could possibly be to address that issue. And a good example of that is most recently in my final capstone course, so that's the final course that we took. We certainly did use that process to work through the issue that we were focusing on. And when I talked about more details can be found for each step, so there is a link on the main page of the NCCMT website called Getting Started. So that's a good spot to start to get more details on each step of the process, and also through the Learning Center as well, which we'll touch on a little bit later. So the process and the model provide a clear and practical way to understand evidence-informed decision-making. I'm the type of person that I do like kind of stepwise processes, so I found that it was quite understandable and kept things organized for me. And following the model also ensures that we consider the best available research evidence, along with other important factors that Susan had mentioned earlier, so community health issues in the local context, community and political preferences, public health resources, and public health expertise. So I had mentioned earlier that many times we do work with a variety of community stakeholders, and it's very important to consider all of the factors that are in the model in all of our decisions that we do make. And following the process in the model, Kristen had talked about this earlier too, in terms of feeling confident in the decisions that are made. And I'm able to show the steps that have been taken to make the decisions as well, so I find that it's a more transparent process to use when I'm using the EIDM wheel. Yeah, so I would certainly recommend, if you're not familiar with the wheel, for you to become familiar with it. And like I said, I certainly keep it on my wall at work, and when I was a student as well, kept it up on my desk at home too.
Great, Shelley, thanks. That gives really a good feel for how you've been able to use the wheel and kind of think through those steps and use them in a systematic way. So thank you. The next resource is actually really a collection of resources. So the National Collaborating Center for Methods and Tools has a registry of methods and tools. The link to it is there. So the registry is a collection of methods and tools for knowledge translation. So some of the tools that are in there are authored by NCCMT, but many of them are authored by other organizations, by researchers elsewhere. So this really is a collection of tools for knowledge translation that are tagged and organized. You can search them in a variety of ways. And some of those tools have a summary statement that we've written as well, just to guide people through what the tool actually is, some details about it so that you can understand what you're getting, and then if there's a link directly to the method or tool, that will be there as well. So I'll just give you a look at what that page looks like. So when you're looking at the Registry of Methods and Tools, this is the kind of thing that you'll see, and you can search the registry in a variety of ways. So Kristen, this was something that you suggested as a good thing for people to know about, and something that's been helpful for you. Can you just talk about how you find the registry helpful?
Yeah, definitely. So the registry is actually something that I really love. And really, I think a lot of it is because it is a collection of so many different types of tools and resources that you can use depending on any of the kind of like tasks or projects that you're working on. So I think there are over 200, I believe, different methods and tools in the registry right now. And I will get into a little bit about the categories and the different ways to search through it that I've used and found most useful. But I think one of the light bulb moments for me was actually even just starting to understand the difference between what a method was and what a tool was. So I mean, from learning through the registry and through the National Collaborating Center for Methods and Tools, I've kind of started to wrap my head around a method being more of a process or a series of steps to organize a knowledge translation activity. So something like a framework, or like a what or a how, and then a tool actually being a product or instrument to carry out those steps of a KT activity. So something more targeted, like a checklist, and really more of a how-to. So that's something that I found actually just really useful right off the bat, because I know a lot of these terms can kind of get blended together, especially with frameworks and models, and having that distinction kind of really helped me, and it helped me to kind of search through the registry as well to find the resources I was looking for. So one of the great things about the registry that I find is that you can actually search and filter by whether you're looking for a method or a tool. And then you can also actually search by which of the 7 steps in the evidence-informed decision-making process you are interested in looking for a resource for. So anything from define through to evaluate. But I think what I found most useful for me during my studies especially was the ability to filter by and focus on specific knowledge translation activities. So whether or not you're looking at doing something that involves a stakeholder analysis or looking kind of at the other end of things with doing a project on policy development. So I think for me, the registry was really useful for kind of helping to provide that additional guidance and direction for some of the assignments that I was working on during my master's, and also kind of just to help wrap my head around how those kind of assignments fit into that larger picture of public health. So just to give maybe a couple of examples of my favorites or my highlights. So some of the specific tools that I found useful in the registry when I was in school that were related to specific KT or knowledge translation activities were so writing a policy brief, so actually getting some more information on some of the steps and the details that are included in writing a policy brief. And I was able to kind of find and use one of the resources in there called the support tool for writing and using policy briefs. So that was very helpful. The other one for me was really an assignment where we were to develop like a mock program plan, and being able to search the registry and find actually the online health program planner tool kind of helped also break that down, because it seems like a really daunting ask when you're just to kind of start to actually develop a program from scratch. So I found those very useful for those specific tools, and then also just in general for some of the more immersion or practice-based assignments that we were working on. So whether it was in the evaluation course or during the practicum, where there really is less instruction on what to include in each assignment, and being able to kind of get a more of an overview and a step-by-step process. I'm also, Shelley, very much a step-by-step person. I found really helpful when looking at that bigger picture.
That's great. Thank you. And I think from your response, certainly it comes through that there's lots in the registry, something for everyone, I think, and that the value of being able to look for these methods and tools is in part that it's efficient. You don't have to recreate everything from scratch. People have worked out some systems and some ways of doing things already, and that can be helpful even if you end up modifying a process or doing it a little bit differently, just to be able to cut to the chase and see, well, how do people write these policy briefs when they do them, as opposed to having to really recreate that from scratch. So thank you for those comments. I just want to reflect on something that's coming up in chat, is how challenging it may be to find research evidence for public health initiatives, given that what goes under the public health umbrella is maybe a new way of looking at things. Yes, that can be challenging for sure, and I think that one of the takeaways for me related to that is how important it is to have good searching skills, so that if you are looking for evidence in a field that maybe draws from evidence in clinical medicine or in some really community-related context that wouldn't necessarily show up in the core public health journals, for example, that you know where to go, how to do that, so that you can feel confident that you are finding what's out there. It's not easy. You need to sometimes look around a little bit, but knowing how to do that in a systematic way is part of the skill set that I think becomes important. Of course, the other comment in chat is that partly the reason for the National Collaborating Centers is to play a little bit of that knowledge translation role, so bringing that knowledge from a variety of areas to the audiences that may interact with the National Collaborating Center. We hope that we're taking some steps to help people find what is out there, even if it's not kind of labeled as public health. So another resource that that came up in our conversations about what's useful for students and others is the Understanding Research Evidence videos. These are short, like 4 or 5 minute videos. They're actually YouTube, so that they're accessible through our website. What we find is that for people who are working in public health and not dealing with research evidence every day, sometimes they find when they go to reading a journal article or a systematic review, there are terms in those sources that they've kind of heard of, but they don't quite have at their fingertips, or they used to know it, but now they don't, or they just kind of need to be a little bit refreshed on, like, what is an odds ratio? What's a forest plot? How do I interpret the results from some of these tests? Well, that's the reason for these videos, is that 4 or 5 minutes later, you can have your answer about what is that term exactly and how does it apply in a very real applied public health context. So they're really easy to follow. They've got some cartooning and some hypothetical public health situations to help to explain why these concepts are important. So Claire, you had suggested that the Understanding Research Evidence videos were something that was helpful to you. Can you talk a little bit about that?
Yes, thanks, Susan. So I really enjoy the Understanding Research Evidence videos. As Susan mentioned, they're really easy to understand, and they're in an accessible format, being on YouTube, which is generally accessible to most people. And they also present complex topics in really an easy-to-understand manner. So they use plain language, and as Susan mentioned, they do use cartoons, which makes it kind of fun to learn about these more complex statistical concepts. So as an MPH student, these videos I would have found really useful for supplementing what was taught in our biostatistics and our epidemiology courses, to just kind of reinforce those concepts again about odds ratios or relative risk and confidence intervals. So now in my practice as a research assistant for the NCCMT, I continue to use these videos when I need refreshers on these concepts, more specifically when I'm conducting critical appraisals, or when I need to really dig deep into the results section to disseminate information about systematic reviews and meta-analyses. So for those examples in particular, I really rely on the forest plot video, which is essential for understanding results of meta-analyses, is to understand forest plots. So it's about a 5-minute video, and it explains it very clearly and concisely.
Great. Yeah, thanks, Claire. I really enjoy watching these Understanding Research Evidence videos too, and they really kind of get to the heart of the matter. So, in a few minutes, you actually feel like you're walking away with a solid understanding. And the videos are always there when you need to dig into that evidence again. So, for people working in public health who, as I say, aren't engaging with research every day, it's really helpful to know that you don't have to hold it all in your head if you know where to look when you need to interpret something or understand something that you haven't seen in a little while. Now, the next resource that we thought would be useful for people to know about is the Public Health Agency of Canada core competencies, which probably many of you are familiar with, has been used as an organizing framework for the resources that we have at NCCMT. So NCCMT has lots of resources. They're available on our website. This is a way of searching for relevant resources organized by core competency. So if people are looking for ways to develop in a particular competency area, I know in some programs the skill sets that are being developed really are explicitly described in terms of building core competencies. So this is a way to search by each core competency and just see what resources are there that might be helpful for you. So, you know, perhaps there are some competencies that you want to build in terms of assessment and analysis is one of the competencies. Maybe some other area of competency like partnership, collaboration, and advocacy, which of course is important to public health practice. So resources related to any of those will be found here. So Shelley, this is something that you had really mentioned as being useful. Can you just talk about how this is a helpful resource?
For sure. So the Public Health Core Competency Toolkit was helpful in reminding me what the core competencies are for public health. So it lists them out nicely in a very user-friendly format that I can access easily from the computer. So you had mentioned some of the main categories for the core competencies. So the public health sciences, assessment and analysis, policy and program planning, implementation and evaluation, partnerships, collaboration and advocacy, diversity, communication, and leadership. So those are the main competencies that are listed in the toolkit, and then there's additional, more specific competencies under each of them. So it's certainly given me a better understanding of the resources that I can access to help increase my public health core competency skills. They're on the website with the toolkit. There's a learning needs self-assessment tool that was developed by the Public Health Agency of Canada. So I found that that was helpful too in identifying which competencies I wanted to focus on, and that link is available on the webpage there. In terms of the MPH program and using this toolkit, it certainly helped me with setting my goals and my objectives in the MPH program, and especially for my recent practicum that I did with NCCMT here. One of the first questions I was asked is what are your learning goals? What are your learning objectives? And so I certainly went to the core competency toolkit and took a look at the ones that I wanted to focus on during my practicum placement. So it is a common question that you will be asked as a student. And it also helped with my yearly updates to the MPH program in terms of what I developed over the course of the year. We had to submit yearly updates, so certainly helped with that too for the MPH program. In terms of work, the public health core competencies certainly relate to my performance appraisals and the professional development goals that I set as a public health nurse. So it was helpful in directing me to the resources that will help me reach the goals. And you'll probably find that if you're in the public health workplace is that they'll want you to set kind of learning goals over the course of the year and may reflect back on performance appraisals as well. And then for interviews in public health, it was a helpful tool to help prepare for interviews for positions in public health. As many times you'll be asked about your experience and your knowledge related to public health core competencies. So it's certainly a great tool to refer to if you are going to be having interviews in the public health field.
Great, thank you. Yeah, that's those are really good examples of how this has been useful. Thanks. So the next resource we're going to talk about is the Rapid Review Guidebook. This is a pretty new resource for us at NCCMT. Certainly it will not be anything unusual for students to be asked to do literature reviews, evidence reviews, and this, of course, also happens in public health practice, that people are needing to bring together a wide variety of pieces of evidence and do that in such a way that it can support decision making. The rapid review process, in a formal sense, is a relatively new way of thinking about synthesizing evidence and literature. So, but there's something really appealing about the idea of a rapid review for people who are busy, people who don't spend all their time doing research but are engaged in practice and still want to bring evidence to bear on their decisions. So that sense of being rapid is really valuable. But rapid doesn't necessarily lead to cutting corners or doing second best job. There is a process for doing a good rapid review, and the guidebook here can walk you through how to do that. This was a resource that Kristen mentioned, and so I'll just turn over to Kristen to talk about how you see this as something that might be useful for students and practitioners.
Yeah, absolutely. Thanks, Susan. So I have to admit, this is a resource that I would have been very happy to have several years ago when I was doing my master's, and I think it'd been really great for writing the papers, just in terms of kind of even developing a focused research question. I think where you start with that kind of does have a cascade effect on the rest of the process. So being able to kind of develop a clear and concise research question using like a PICO-S formula, and then where to go and search for the information that you're looking for in the most efficient manner, and I guess as in an ideal way, in a rapid way, would have been very great for some of the assignments that I was working on. But for me right now, especially, I guess, I'm currently helping out with conducting 2 rapid reviews on interventions to prevent alcohol and marijuana use in adolescents. And I found this guidebook very, very key for kind of helping walk me through this process and the team that I'm working with on this. So I really found that it does help outline the process, and even more so, it kind of helps to show what kind and what amount of information is actually really expected in each section of the report. So it's only about a 25-page document that goes through. So I think for students, I think that's probably on the lighter scale of their reading requirements on a weekly basis. But I've also found, really for the guidebook specifically, that it really helps to provide more guidance on that synthesis component. And I find it can be a bit daunting once you have kind of collected all the evidence and you end up with this wealth of information, and it can be really challenging to make sense of it. So, the guidebooks really help us to kind of focus our efforts on what we actually want to get out of the data extraction and synthesis component, and what are the important aspects to consider when we are synthesizing evidence. So whether we're looking at intervention characteristics, or are interested in specific outcomes, or settings or populations that an intervention is taking place. So I found that that's been very helpful to kind of guide us through the process.
Great. Yeah, thanks for describing that in a little bit of detail. It really does boil down some of the process to make it more accessible. So thanks for that. The next resource or set of resources that we want to bring to your attention are these online learning modules. And you'll recognize on the page there that the wheel is showing up. And so these are online learning modules that are free. They're self-paced, so you can do a little bit and then come back to it another day, so good for busy people. And there are modules related to each step in the wheel, so each step in that process of evidence-informed public health. So for people who are looking to build skills in a particular area, these online learning modules will take a couple of hours maybe to work through. They have examples in them that make the concepts relevant to a public health context. And Claire, this was something that you brought forward, so I'll ask you to talk about how you see these as maybe something useful for people to look at.
Great, thanks, Susan. I really love these online learning modules. I find that they're really great for helping to build skills to be more efficient in understanding research, searching for research, knowing what to do with research once you have it. So there's a wide variety of modules on the NCCMT website. One of my favorite modules, though, is the searching module, and something that I'm hearing from the other panelists and from Susan tonight is really the importance of being able to make a good research question so that you can be able to search for research and literature on that question, and you're getting the results that you need. And the searching module really helps do that, as well as give you some tips on where you can search. And it also introduces the 6S pyramid, which is a really important resource that is going to be discussed a bit later on as well, that discusses or that goes through the different levels of research evidence. So one of the other set of modules that I really like are all of the ones on critical appraisal. I find these really helpful in my day-to-day work as I'm conducting critical appraisals of systematic reviews and meta-analyses for health evidence. And in my MPH, we had a policy class where we had to conduct a knowledge synthesis. So having these critical appraisal modules would have been really helpful at the time, as we had to include critical appraisals of literature, so we knew what the quality of the research literature was that we were including in our knowledge synthesis. Also, for our health promotion class, as Kristen mentioned earlier, we also had to plan a health promotion program. So being able to do critical appraisals of literature to know that what the quality of literature you're using is, that you're basing the program on, would have been very helpful. The other thing that I find the modules are really great for is also professional development. So people that may be graduating in the near future may find these modules really helpful, so that you can show potential employers that you're continuing to build your capacity in public health and in different areas of public health. One last thing I'd really like to mention is that our modules were recently just certified by McMaster University, and they will be appearing soon in a new portal that's to come in the near future. There will be a fee associated with this, but our online learning modules as exist in our Learning Center will remain free. But the benefit to the McMaster ones is that they are certified by the university.
Thank you, yeah, for bringing that up, and certainly some options for people. So if that's important to have that official certification, you can do that. If you do the learning modules just as we're talking about them now, those are free, they're accessible, and you do get a certificate of completion afterwards. So if you're just looking for that level of proof that you've worked through the module, that is part of the system as it is. So Claire was talking about the success pyramids, and that's a little bit referred to on this slide, but I wanted to bring out the success pyramid as something that I think is really helpful for people to know about. So the 6 S's are shown there in the pyramid, starting with systems and then moving down to summaries and synopses and on from there. The thing that I always emphasize when I'm doing training or workshops for NCCMT is that our work really is intended for public health practitioners. And that means that our resources are intended for an audience that emphasizes efficiency. People are not spending their life's work answering a particular evidence-based question. They need the answer quickly so that they can get on and actually do the work that they're interested in. So a lot of the resources that we have at NCCMT really emphasize that efficiency piece. The 6S pyramid is a really useful conceptual tool for getting to the most synthesized evidence so that, in a sense, someone else has done the work for you of reading everything and synthesizing. And your task then is to check to be sure that that work has been pre-appraised for quality, or that you do the appraisal yourself so that you know that the synthesis has been done in a good way. The pyramids and what's being shown here, the general sites for public health research evidence, this pyramid will give you suggestions of good sources where you can search for evidence at each level of the pyramid. So this one that's being shown on the screen is about summaries. Where can you find summaries? So that would be things like guidelines, for example, very highly synthesized summaries of evidence. So the National Guidelines Clearinghouse is a big one, but there are others there as well, with just a little comment about what you'll find in each of those sites. So the Success Pyramid is good for lots of reasons, but particularly good for people who want to cut to the chase and get a good quality answer quickly. Really important way of doing that. And the other resource that I wanted to bring to your attention is health evidence, which you've heard people talking about because some of our presenters tonight actually work on some health evidence pieces as well. Health evidence is a database where you can search for systematic reviews in public health. So specifically, systematic reviews that focus on the effectiveness of public health interventions. So these are not reviews that health evidence does. These are reviews that are published in journals, in Cochrane, other sources, but they're pulled together here, and they are appraised for quality. So that's one additional value-added piece that you get with health evidence, is that the appraisal has been done. For those of you who are maybe working on building critical appraisal skills, health evidence is kind of a nice place to be hanging out, because you can actually see the critical appraisal results for each of the reviews kind of in the background. So you can maybe do your own review and then compare it to what our expert friends at Health Evidence had to say about the quality of that review. Just gives you kind of a little way of checking on your own assessment of the quality of a systematic review. And systematic reviews are so critical for, again, those busy people, people who are wanting efficiency, wanting to have a good breadth of evidence, but aren't necessarily going to read every article that's published. With a good quality systematic review, you don't have to read every article that was published, because someone else has done that work for you and has brought it together in a way that actually enhances your understanding of all of that evidence because they've done it in a way that synthesizes effectively. So health evidence, just a great resource for many topics in public health. And I will say that I'm often surprised when I poke around in health evidence that there are reviews on topics that, at least for me, I'm surprised that there is something about this topic or that topic. So for people who say, oh, you know, I'm working in this field, but, you know, there really isn't anything on it, I say, well, have you checked in health evidence? Because I certainly get surprised all the time about what it's possible to do a review on, and maybe you will be too. So even if you're working in an area that's kind of emerging, you still may find something really useful in health evidence. So I encourage you to check that one out too. So that's our run through of some really, I think, great resources from Shelley and Kristen and Claire, and I threw in a couple too that are kind of my faves. So at this point, I would really like to hear from participants in the webinar about what your perspective is. Why do you think evidence-informed decision-making is important? How is that showing up in your undergraduate or graduate program? Are there gaps? Maybe there are tools that we haven't talked about that you think we should know about, or maybe some smart people should put their heads together and figure out a tool or a framework for something that you just haven't seen. So please use the chat box. I see people that are already putting some comments in, but please let us hear from you, and questions and comments very welcome. People saying that if you're new to public health, the webinar gives you a map. Maybe you'll avoid some detours, which certainly is our intent with the registry of methods and tools that we talked about. Is sure, you can Google search, but what you get in the registry is you have the benefit of some additional filtering that we've done to say, you know, these are tools that we see relevance for public health. We give you evidence about how they've been evaluated, you know, how the tools have been used. So you're not just poking around in the dark. There is actually some filtering there to say these are perhaps some good and useful tools in public health. So that's exactly what we had in mind, is to be sure that people had a kind of a one-stop shop for tools that would help them to do evidence-informed decision-making. So I see a comment there. Evidence-informed decision-making is important to reduce resource wastage on things that won't work. For example, if something is not related to the context of the community to which solutions are being applied. Yeah, couldn't agree with you more. I mean, we're about being efficient in our own work, but we also, all of us want a public health system that delivers programs that are going to have the desired effect. And so you want to know about the effectiveness of the intervention, and that's what the evidence will bring you. You also want to know about your local context, what's happened there before, how much of a problem a particular issue is. Communities differ, and so we need to take that into account as well. So hopefully some of these tools will help you to do that. So glad to see people are saying that they may be, that you may find some of these useful, and we've got some new students on here, so that's fantastic because, of course, from our perspective at NCCMT, we want to continuously enhance the preparedness in the public health system for evidence-informed decision-making. Being sure that people have all the skills that they need to really make good evidence-informed decisions. And if students come into the public health workforce with those skills already, so much the better. So I'm really happy to see that we've got some new students who are seeing the relevance of these tools through your studies and beyond. Jocelyn has said that she's used some of these resources, so that's terrific. Happy to hear about that. Now, Henry is commenting that the concept of evidence-informed decision-making is logical, but some people would rather not use evidence but are convinced by personal and biased assumptions, small pieces of anecdotal evidence, which I find frustrating. Well, you're not alone in that, Henry. And, you know, part of the work that is involved in evidence-informed decision-making sometimes is actually that I would call it a knowledge broker role, but sometimes it's not even so much about knowledge. If you have an understanding of evidence-informed decision-making, you may be able to bring awareness within the organization that you're working in, or with your student colleagues perhaps, of what it actually means to do evidence-informed decision-making, why those assumptions and biases should be something that we're concerned about. Now, some people don't take it very well when you start pointing those things out. So, there's a little bit of an art to it, but there are some resources, a couple of videos even on the NCCMT website where leading figures in the public health field talk about why evidence-informed decision-making is important from their perspective. And so, some of those perspectives that they bring may be that kind of peer-to-peer, people saying, yes, in my work in public health, I've had to do this because we don't have a lot of money and we can't be wasting it, because I want to sleep at night and I want to be sure that we're doing things that aren't a waste of money or aren't going to harm people. And the only way to know that really is to look to the evidence that we have to understand that a little bit better. So yes, it can be frustrating, and the more information we can bring to the situation, the better it is. So keep your chins up, and hopefully some of these resources will help to persuade people. So Claudia, you're saying that as well. Evidence-informed decision-making can be a great tool of persuasion. Why should people follow your vision? So to be able to say, well, it's not just me thinking this up, but that there are some there is some evidence behind some of these ideas. Starting to see these more emphasis on EIDM in curriculum in med school, nursing school, so those skills are being built. I think that's really true. I'm seeing that as well, and certainly in my connections with graduate programs, I am seeing that more and more their schools are building these skills right into what's part of MPH and other programs. So a question about how evidence-informed decision-making could be used in emergency preparedness. We certainly keep in mind that for what I would call emerging issues, so a disaster where things are changing very rapidly, or a new disease that has not really been seen and we don't know a lot about it. When you're dealing with something like that, that's not really the time to start building skills for understanding evidence. You want people to be really able to pick up on the evidence that is there, as limited as it might be, and be able to work with that. So as with most things in emergency preparedness, so much of the work is done in advance. It's about preparedness. It's about planning. And that's true whether you're talking about emergency preparedness in a community or whether it's talking about a workforce that is prepared to use evidence even under challenging situations. So, you know, the work that that you're probably all doing to build your skill sets for evidence-informed decision-making will help you when there's an emergency or when you need to get to evidence quickly to help with that. The National Collaborating Center for Methods and Tools did a workshop, a webinar, I'm going to say it was maybe a year ago, maybe 18 months ago, in collaboration with the National Collaborating Center for Infectious Disease. And we were talking not exactly about emergency preparedness, but about that situation of emerging disease, you know, new situations that we really don't know a lot about. And we talked about how the evidence-informed decision-making model might still apply in that situation, even though you're working on maybe a handful of cases or where the evidence about the course of a disease is really changing rapidly. Still important in those situations to be thinking about the critical appraisal. What is the source of this evidence? Can we trust it? Are there similar kinds of things that we can learn from and draw from? So certainly the speed at which we look for evidence changes in an emergency or in an emerging situation, but the process, the logical kind of step-by-step process of dealing with whatever evidence there is, ideally remains the same. So another question about how do we have the survey tools, templates, instruments that will allow us to address Indigenous perspectives, ethno-racial differences in groups, and health inequities and disparities. Those issues come up in every step of the wheel. So in defining the question, we need to think about who are we talking about. So in defining a question, we always think about the population. Really important to refine how we think about populations and know good terms to search for those, good sources of information for groups that perhaps have been marginalized in research. So thank you for bringing that perspective forward. I would say that tools and instruments probably there's room for growth in that area. But having said that, I think probably a year ago, I did, for NCCMT, a partnership with the National Collaborating Center on Determinants of Health, where we actually looked at methods and tools at each of the 7 steps in the wheel that specifically brought in health equity concepts, and that link would be available through our website as well. If you have trouble finding it, just drop us a note and say, I want that recording of or the slides from the health equity webinar, and we'll find it for you. There are some pretty good tools out there that can actually help to surface some of those issues related to health equity. So that's a great point, and thanks for bringing that forward. So do these tools provide an exhaustive search of the evidence available out there? to the best of our knowledge? Excellent question, and this really is a critical appraisal question. So by being familiar with those concepts of critical appraisal, it actually leads you to ask that question of, well, do we have it all, or do we have enough to really feel confident in the decision that we're making? So if you are looking, for example, at health evidence, you'll be pretty confident that if there's been a systematic review that has come out related to a topic in public health, it will show up in health evidence. We've got about 4,800 systematic reviews in there now. But knowing where else to search as well to satisfy yourself that you've gotten everything that you should have is important. What's, I think, most important is not that you have found and read everything that was ever published on a source. And I say that not to be dismissive, but because I see people get bogged down in that all the time is, well, I've got like 600 hits, 600 relevant articles, and you need an answer in 2 weeks. Well, you can't really do justice to reading 600 hits. So what do? Sometimes people just read some of them, and that's not really a good systematic way of doing it. So that's why we really emphasize systematic reviews. So if you find 1 or 2 systematic reviews that have done all that reading for you, you're away to the races. It really helps to get to that, what Erica was talking about, the exhaustive search of evidence. If someone else has done that exhaustive search of the evidence and can summarize that for you, how fantastic is that? And if they've done a good job of it, then you really get a good answer quite quickly. Just a couple of other comments. Humbling to realize how much you do not know. Really please poke around on the website. All of this stuff is really accessible, so bring some curiosity to it, let us know how you're doing. If you've got questions, we are a pretty friendly bunch, so you can drop us a line at any time. So thank you for all these comments. I see that we're just about coming up to 8:30. So if there's a question that you have that hasn't been answered, sorry about that. We'll be happy to hear from you. When we shut down the webinar today, there will be a survey. We really would welcome your feedback. This is the first time that we've done this focus on resources for students. So really would welcome your feedback about whether this has been useful for you. And if you want to know more, nccmt.ca is our website. You can contact us at nccmt@mcmaster.ca. And if you just put in your email that you came to the student webinar and you have a question, that will get to the right person. So don't be shy. We're happy to hear from you at any time. Thank you so much. Thank you to our presenters, Shelley and Kristen and Claire. Really great to hear from you, from your perspectives, and I hope that that has been helpful for everyone on the line. Have a wonderful evening, and thanks again.